Thank you, Darla. And a special thanks to you too for teaching the class for us.
Here is a more in-depth case study, one-on-one, with an RT and a patient.
Just sit back, relax, and enjoy.
Good morning, Mr. Joaquin. I'm Sally from Respiratory. What brings you in today?
I've had this relentless cough for 3 months now, and recently I've started coughing up this thick, green stuff.
Oh, I'm sorry to hear that. Have you had this cough before?
Yes, for the past 2 years.
And how much green stuff would you say you cough up a day?
Let's see, every day I fill about a shot glass.
Wow, okay. Do you smoke or do you have a history of smoking?
Yes, I smoke about 2 packs a day.
Good Lord, how long have you smoked?
I don't know, about 30 years I guess.
Do you experience any shortness of breath?
Yes, actually, all the time, even when I take a shower, even though that's only once a week.
Do you have any inhalers at home or any pulmonary medication?
No, sweet cheeks, I do not.
I would appreciate, Mr. Joaquin, if you would stick to calling me Sally.
I'm sorry, Sally.
Thank you. Okay, Mr. Joaquin, we are going to perform a few tests to further understand exactly what is going on.
Is it going to hurt?
Well, one of the tests known as an ABG might feel like a little bee sting, but I promise it will be a quick procedure.
Good morning, darling. What do you have on patient room 201?
Hello, Dr. Stack. We have a 56-year-old, heavyweight, male, who came in with a chief complaint of frequent productive coughing, with green sputum about 30 mL a day.
Ah, sounds like we have a blue bloater on our hands.
This has been going on for 2 years now. He's a 60-pack-a-year smoker. I noticed he has peripheral edema, JVD, and obvious cyanosis. His breath sounds have bilateral wheezes and moist bronchi. He has a 9 respiratory rate, 120 heart rate, and a blood pressure of 144/90. His ABG has a pH of 7.36, CO2 of 87. Bicarb of 48, and O2 of 64. So it is evident that he has compensated respiratory acidosis. His chest X-ray shows dark lung fields, hyperinflation, flattened diaphragm, narrow bronchial tubes, and his heart appears long and narrow, indicating cor pulmonale. The spirometry showed a decrease in the FEV1 to FVC ratio, which was 55% of the predicted, and decreased FEV1, which was 35% of the predicted.
Thank you, Sally. Splendid job. It sounds as though Mr. Joaquin has stage 3 severe chronic bronchitis. Please get a sputum sample right away and administer him a short-acting bronchodilator, a long-acting bronchodilator, an inhaled corticosteroid, and make sure he gets his influenza vaccine. And since he seems to be in mild respiratory distress, give him oxygen therapy as well. If his cough becomes weak, then he will need bronchopulmonary hygiene. But there is really no need for me to tell you all of this, since I know RTs are extremely intelligent.
Yes, doctor. And what about pulmonary rehab and smoking cessation? I think that is very important and will be of great benefit to Mr. Joaquin.
I couldn't agree more. I knew there was a reason I keep you around.
Hopefully it is because you think I'm a great RT and not just because of my looks.
Oh, of course. I have lives to save now, so I better be going. See you later, beautiful.
Goodness gracious. Why do I put up with him? Okay, so I am going to give Mr. Joaquin 1.25 milligrams of Xopenex Q6, after 500 micrograms plus 50 per puff twice daily, and 3 liters nasal cannula of oxygen.
Finally, what took you so long, sweet cheeks? It was getting terribly quiet in here.
Okay, Mr. Joaquin, I analyzed your results and spoke with your doctor about your treatment plan. I am going to give you some aerosol medications to help open up your airways and decrease inflammation and improve your oxygenation. If you start having trouble getting out your secretions and your cough becomes weak, I will also administer you bronchopulmonary hygiene, such as the Acapella or CPT. I noticed that you haven't had your flu vaccine either, so you'll be getting that as well. Do you have any questions or concerns, Mr. Joaquin?
Nope. I'm ready to get the show on the road.
Okay, Mr. Joaquin, if you wouldn't mind, please give a sample of your green stuff in this cup so we can take it to the lab and run some tests. Then we'll get started.
How come Mr. Joaquin is in the ICU?
Just about 45 minutes ago he went into acute ventilatory failure. His SATs dropped dramatically to 79 and respiratory rate jumped to 28 with use of his accessory muscles. He was turning even bluer than he is now. We had to bag him on the way to the ICU while we were setting up a BiPAP. I took an ABG and his O2 was 54, CO2 was 94, and pH 7.28. After 30 minutes on the BiPAP I took another ABG and his oxygen improved to 71 and his CO2 decreased to 76. He is stable now and tolerating the BiPAP well.
You never disappoint me, Sally. Keep monitoring Mr. Joaquin and let me know of any changes.
Mr. Joaquin, I'm glad to see you are doing better.
Thank you. The doc says I can leave today.
That's good to hear. I have some advice for you so that you don't end up back in the hospital. First, make sure you are taking your medication every day. Next, start going to a pulmonary rehab. Exercise and socializing helps the body and mind. And make sure that you get the flu vaccination every year. Lastly, use the Acapella we gave you to help you cough up all that green stuff. That way the green stuff doesn't cause infections. By following these steps you will be able to manage your chronic bronchitis.
Thank you for all your help, love.
You're welcome. Take care of yourself, sweet cheeks.